my hearty congratulations. I'm a little concerned that Provost Butler took most of my speech, but I'll do well, I think. Hearty congratulations to this incoming class, to Carver College of Medicine. You worked hard to get here, and we are proud of all of you. It might be the only the second time you've been in Iowa. Special welcome to you and your family if they could make the trip. Some of you are from medical families. Congratulations to your families for making the practice of medicine fun. None of our 5 children have chosen medicine, so this legacy is going to have to skip a generation, as it did for me. My grandfather was the last medical person in my family. Some of you are the first in your family to go into medicine. Wow. How all your friends and family will ask for your advice this coming winter vacation. Kidding aside, I share the pride of your families and your significant others. I thank them for the work and the sacrifice and support that they provided you through the rough times. Don't forget to thank them. You could even do that now if you wanted to. Thanks, everybody. You might need them for quite a bit longer. If you want to wave, salute, blow kisses, go ahead. Thanks, Mom. All right. I asked a young friend what the speaker at her white coat ceremony said, and she said, he made 3 points and repeated them several times and really tied it really nicely together at the end, but I can't remember one of the 3 points. Mind you, she got into medical school, not the best medical school. And I'm suspecting she had to memorize a few things, but she could not remember what was said. I will try to be more memorable. My topic is healing. When you started, when I started, when all of us started to think about the human body in 5th grade, we learned in systems: the digestive system, the cardiac system, the respiratory system, and the urinary system. That was for you. Thank you. Yeah. It was a great way to organize our learning. We can follow a particle of food or a molecule as it moves through the body. Just because it's a good way to learn does not mean it should govern the way we interact with our patients. Sometimes we doctors get this confused, and we think of our patients as a collection of organs organized into systems. It sometimes gets worse. We look at the diseased organ system and forget that it belongs to a patient. And when a patient's illness gets very complex and serious, he or she can have an impressive array of doctors, all intelligent and compassionate, each looking at a single organ system. In an intensive care unit, it would not be unusual for there to be 4 subspecialists for a patient, but each looking at an individual system. Where is the healing in that setting? Healing is when a physician or a medical student or a clinician of any kind takes the time to reconstruct the patient from all those systems and put them back together again. Putting them back together again. Me, you ask? A medical student? A first-year medical student? Yes, you. How can I put a patient back together again? Okay, so this is where my moment of truth. I would like to try something, and now you'll know how I do lectures when you go to medical school. We're going to try something. Could every other one of you stand up? This is like from gym in 4th grade, okay? 1, 2, 1, 2, 1, 2, 1, 2. All right. Now, I'm going to just ask you, how we doing? All right. Now I want you to talk about, how you're going to study for anatomy, how your summer vacation was, with the person seated next to you. Okay, okay, all right. You can sit down now, thank you. If you were unlucky enough to be the seated one, you were craning your neck, looking at nose hairs, and you might have felt a little towered over, all right? So, in order to put a patient back together again, sit down. Next, listen to their story, their narrative without interruption for 5 minutes, and ask them about the last 6 months of their life, and allow that narrative to touch you in some way. Let me give you an example. You're going to know I'm a procrastinator because this just happened within the last couple of weeks. So my mother has had, for the last 2.5 years, has been struggling with prosthetic knee infections. She's had over 8 knee procedures. The last one was in late July, and her left knee was surgically removed. So she's now mostly sitting in a wheelchair with her left knee extended in a brace without a knee. And she was given daily antibiotics, twice a day, intravenous antibiotics. And this huge volume that she was given at 86 years old caused her heart to fail. So somebody told her that she had heart failure. So here is a woman who has come back resilient from horrific orthopedic infections, and someone said, "You have heart failure." She was broken, absolutely broken, until a cardiologist came in and sat down next to her and said, "You are not broken. These are small blips in your screen, and you will get over this." It was a moment where I realized the value of that cardiologist. So a subspecialist listening to my mother's devastation, the last straw, she was ready to throw in the towel until that cardiologist came in. Let me tell you something out of my own experience, also just last week. I had a patient who did critter control for residential critter control, who came in with very advanced cancer and horrific pain. And I was going to see him to help handle his pain. He is there with his wife, who is clearly tearful, I think fearing that this pain meant that the cancer had progressed. So we talked about a regime of pain control, something that would help the nerve pain and something that would help the muscle and bone pain. And then I looked at him and I said, "Could you tell me the funniest critter control story?" And he and his wife looked at each other and said, "The opossum." Code word. So apparently, a woman called him and said that she had a possum under her sink, and that she had been catching them for over several months, and each time she caught them in a have a heart trap, she would take them over to 2 trailers over in her trailer park. And the guy said, "No, ma'am, that opossum beat you back to the sink. You can't do that." So he caught over 12 opossum over the course of a week. And he said to his wife, "Loretta, we're not accepting any invitation to eat at their house because I saw what the opossum did to their pots and pans." Well, we started laughing in such a way that we connected. He touched me. All of our subsequent conversations and follow-up by phone have all been about his critter story. It's allowing him to be a human in its entirety and letting that touch me. I'm going to tell one last story. You can tell that stories are important in my field, but I think important to all of us. The last one was a patient with advanced cancer who was in the intensive care unit. And we were gathering with the family, all his physicians and his family were gathering to try to figure out what kinds of interventions he wanted at this point in his life. So I asked him the dignity question, which goes like this: what do we need to know about you to take good care of you. And he said, he was 93. He said 70 years ago, the historians in the crowd might quibble with this, but 70 years ago, I was on Omaha Beach, and a bullet whistled past my ear and hit my buddy. I've been on borrowed time for 70 years. Would you let me go home and be with my family? This is exactly what happened in that room. Until the son said, Dad, we're going home. It was among the quickest family meetings I had had. Profound. What he told us about him, what was a patient with devastating illness turned into a hero in just one question. That's what I want you to do. You are not the king's men and the king's horses. You can put the patient back together again. Don't let the way we teach you get in the way of your humanity. I know you work hard to put on that white coat, but there'll be moments when you should take that white coat right back off. Abandon the computer monitor, go to the patient, sit down, listen, heal the patient by reconstructing them to their whole. Let the patients touch you with their stories. I take this sitting down business very, very seriously. I have a golf chair that I used to use around the hospital until my team begged me not to use it anymore because I look so eccentric. They thought I like Miss Frizzle on Magic School Bus. And I almost brought it, but I didn't have it in me. All right. I named it the Cass Chair after Dr. Cass at the University of Rochester, who appeared delighted when I asked him if I could name this chair after him. So the reason it was named after him is on rounds he asked a question in Socratic method. What's the one item you need to take a medical history, he said. And one student said, a pen? A set of ears? I thought that was a really good answer. No, students, you need a chair to take a medical history. Sit down, listen to the narrative, reconstruct that patient into their whole, and healing will happen. When I dropped off my daughter about 5 years ago at the University of California, I heard a dad say in Spanish to his daughter, be strong, but not too strong. Call us if you need us. In closing, be strong, but not too strong. Call us, and I mean me, if you need us. Thank you very much.